Pages, bro. When's this exam?
Hi, everybody.
Hi, how are you?
Good. How are you, Bobby?
I'm doing pretty good.
I know
Hey,
you sent I know you sent me an email. I just
yes,
haven't had a chance to get back yet. I had to do a review
that's
session this morning. I have several
okay. I
message to
sent it to you.
respond to.
I didn't expect to get a response back. I thought
Yeah.
I sent one yesterday and or not yesterday, it would have been Friday. I think I thought I sent it. Not Friday. We're on Friday. Wednesday, I thought I sent it. But I went in there today and I was like, oh, I never sent her the email. So I guess I thought about it and just never actually sent it.
Are these different
No,
clinical
I
days?
just sent it this.
I saw it. I didn't read the content of it. Are these for different? Well, I read it quickly, but
It's this it's the same ones that we talked about that I would have
okay.
been in a different class. It just happens that that one exam falls on, I think I said the 17th of February.
Oh, okay. So one of
And
those conflicting dates falls on an exam day.
yes.
Yeah, no
So,
problem. So I will, you and I, that's good to know because then everybody's going to be in the same boat on that
right,
day.
right.
And you'll just have to take it with a different class of mine
Okay,
because
okay.
You have Dean Brown's permission
Right.
to attend a different section that week. So if it's an exam week, that's an exam week,
Okay.
different
Okay.
section.
I just wanted to make
Yeah.
sure. I noticed it when I was looking over the schedule you sent.
Yep.
And I
No
was like,
good. That's good to
I
know.
better shoot her a message because I'm not
Yep.
sure how we'll do
Okay.
that. So, okay, no problem.
Yep. And I'll respond to you sometime today.
Okay, that's fine. It's no hurry. I
Busy
just wanted to
day.
send it so that way I didn't forget to get it sent out.
Okay, sounds great. Hi, everybody.
Hi.
It's
Hello.
Friday.
Hello.
Hi, Tiana. You guys made it through almost week 2. Boy, how time flies, huh?
It does.
Yeah. So as you're getting settled in, don't forget to put your name and your campus in the chat. We're going to have some extra students this morning. Trying to still accommodate my students from Monday, from MLK holiday day, that are attending different classes this week. So we'll have some extra students today. Hi, Joanna. Yeah, I know.
How are you?
Good. How are you?
Good.
Good.
I read your email now that I'm logging into Canvas.
You what?
I'm seeing all your emails that you sent me yesterday.
I think I just sent you one.
Yeah, there was one, yeah. But then the one that I didn't respond originally. That's why.
Oh, no worries. You'll eventually get around to it. I realize you guys are screaming busy this term. Hi, Tiffany. Ronke. Brittany. Brittany, when you have a minute, just adjust your name, put your last name in there on your phone so I can see.
This is my laptop.
Oh, okay.
Yeah.
No worries. No worries. Okay. Everybody coming in at the buzzer. How's everybody feeling about this class so far? You keeping up?
I can't wait for the quiz.
Don't do the quiz until we're going to do it together.
Okay, all right, good.
Did you already do it?
No.
No, don't do the quiz. We're going to do it together.
Okay. I feel pretty confident. I really do.
Oh, yay. I'm not going too fast or
No, ma'am.
trying to give you too much information.
Mm-mm.
Okay. Okay, it's officially 1 o'clock. Well, it's 1 o'clock for some, 12 o'clock for some, and it's 11 o'clock for me.
Mm.
Since I'm in snowy, cold Colorado. Freezing out in the 20s today. It's freezing.
Goodness.
Ugh. I'm too old to be part of winter anymore. I need to go someplace. I need to go someplace warm.
It's just 54 here in Alabama.
I'd take 54. To me, I'd be in my bathing suit suntanning if it was 54 degrees.
Mm-hmm.
Anybody have an extra room anywhere where it's nice and warm? I don't require much. I'm pretty easy. I just need sun. I don't know, the older you get, the just more, I just can't do winter anymore. Although I don't know why I'm even saying that, because Tom and I have a second home up in northern Wisconsin, way up in northern Wisconsin, up by the Lake Superior. We're heading up there a week from tomorrow for a while. And it's nothing but, I mean, you think it's cold here. And I looked at the forecast for next week and it's like, the lows are like -15, -12, minus whatever.
No, thank you.
Mm.
I know. Just being confined to the house. Anyway, okay, let's get going. I need the few of you that don't have your cameras on to please turn your cameras on. Tiona, I can't see you. I'm looking at your ceiling. Anybody that has a blurred camera on, blurred vision, blurred screen, if you could just unblur it, that'd be great. Hi, Danella. There's Tiana. Okay. Timberlake, do you have your camera on, please? There you are. I like to see everybody's smiling faces. So welcome to Friday, week 2. You guys are almost through week 2. We've got one more week to go next week, and then we are in exam mode. I did send out the exam review schedule for the term. Everybody got that, right?
Yeah.
Okay.
So it's in your announcements from a couple of days ago. There are going to be, let's see, our exams are in weeks 4, 7, 10. So there are going to be 3 exam reviews in the weeks prior. So weeks 3, 6, and 9. Okay. And so it looks like they're going to be Monday, Wednesdays, and Fridays. Okay. I think Professor Ford is on Mondays. I think Professor Kershaw is on Wednesdays, and I'm on Fridays. So you have 3 opportunities to do exam reviews. Okay. You'll also get the recordings. Okay. We share our recordings with each other. So you have 3 live exam reviews to go to, and then 3 recordings. And as I said before, if you can do it, I know you guys are super, super busy. If you can prioritize even attending 1 exam review, there really is it's fact, there's a direct correlation with attending live reviews versus listening to recordings not that recordings are not bad. I mean, that's plan B. But there's a direct correlation with increased exam scores. Okay. The other thing I sent you out this week was your study guide, right? So if you haven't taken a look at it yet, what I would suggest you do after this week is just go through your study guide, right? Because 2/3 of the study guide, the concepts should now, after today, should be covered, right? You got week 1 material, week 2 material. You've got, oh, good. Alishka, you were on my to-do list because you said Wednesday. So good. I'm glad you're here. Thank you. Great. Welcome. So your study guide is exactly that. It's a guide to help you prepare for exam 1. So last week was 1/3 of it. After this week would be 2/3 of it. And then after next week, everything on the study guide should have been introduced to you. Okay, does that make sense? So as you start preparing, I would go through your study guide and maybe check off the areas I'm good with. I know, I understand. I don't have any questions. Highlight those sections, but then please mark up the sections that you're having trouble with. You're having trouble understanding. You're having trouble understanding the concept. And if prior to the exam, you're still having trouble in some areas, please reach out to me. Okay, and we'll schedule a tutoring session to go over those areas. Okay. What else did I send you this week? What question? We're only in week 2, so what questions do you have from last week? You've got 2 content recordings, one from week 1, one from week 2. I'm going to review some content here at the beginning of our class today, and then we're going to do a couple things. We're going to do the quiz. We're going to go through some questions that I want to ask you guys just to see if we're keeping up. And then at the end, I'd like to go through the HESI prep. So have that prepared, have that somewhere on your desktop, because everybody should know about the HESI prep now. Let's see. Cheyenne, those exam reviews are in your announcements. I sent out a Word document with all the announcements for next week. Well, they're all on Mondays, Wednesdays, and Fridays, the week before the exam. I don't remember the specific times, but that document is there for you to print out and plan ahead for the whole term, because there's exam 2 reviews on there, there's exam 3 reviews on there, and there's HESI reviews on there. Right?
Thank you.
You're welcome. You're welcome. What was I just saying?
The exam review.
Well, we covered that before that.
Reviewing from last week.
Yeah. So you got plenty to prepare for. Okay, you've got your content recordings, you've got my week 1 and week 2 announcements, which have PowerPoints, and you'll probably realize that I'm only sending out the PowerPoints that are full chapters. Okay, so for example, last week, the only full chapter you were responsible for was chapter 1. The other readings were bits and pieces of chapters. So if you're just getting page numbers, like this week, you had in fundamentals chapter 11 and 12, the whole chapter, growth and development, health risks, all that. But you also had a whole bunch of assignments in your med surge book for all the different common childhood ailments, but there were only a couple of pages per chapter, right? So that's all you need to read is that part, those pages. You don't, just because hypertension comes up in chapter 8, even though you're only assigned 2 pages, do not read the whole chapter. Just read the pages that you're assigned to. I mean, otherwise, if I sent out PowerPoints for everything that was due this week, I mean, just those common childhood ailments, you would have had 8 or 9 extra PowerPoints. Doesn't make sense to send those out because you're only responsible for a certain section of the chapter. Okay, so that's why I'm only sending out the PowerPoints of the full chapters. So this week you got PowerPoints for 11 and 12. Make sense?
Yes.
You really need to stay focused on what's assigned. Okay, and not go above and beyond that. All right, otherwise you're going to get too overwhelmed. I mean, there's a reason we skip through chapters and skip through the book. I mean, it'd be impossible to read the book from cover to cover. We pull the most important concepts out for community nursing, and then we go to the chapters and pull out the information that is critical for you to understand that concept. I mean, that's kind of the way it works. Okay. Anybody have any questions? I think I've figured out my share screen, I think. I want to go over a couple of things with week 2. Tell me about the school nurse. What'd you guys learn about the school nurse? What does the school nurse do?
take care of kids in school.
Kids in school to make sure, like simple stuff. If it's something, that they can't handle or they don't have the tools to handle, then that's why when they will call to get them into the hospital.
So for
They am-
example, like what?
They administer medication to kids, like we help them with their inhalers and stuff like that. They do prevention. They're educators too.
Mhm.
They're consultants.
Pardon me?
They're consultants.
Okay. So I just retired last year after 20 years in school nursing. And I can tell you the days of kids coming to the clinic for Band-Aids, ice packs, and hugs are over. Okay. I can tell you one of the roles of a school nurse is direct caregivers as well. Because as you know, in our schools, we have complex kids with multiple needs. And I can just tell you some of the direct caregiving tasks I performed over the years. Okay. And especially as recently as I left. School nurses, we did trachs. Okay. We did trach suctionings. We did G-tube feedings. We replaced G-tubes if they need to be replaced. We did full diabetic care, insulin injections, pump management. We did catheterizations, female and male students. We did mental health crisis intervention. We did disaster preparedness for each school. The nurse was part of the disaster evacuation plans. We also are an important part of the special education team, right? The health component of the special ed student is extremely important. Okay, we coordinate care with our special needs students, whether they need PT, OT, language, whether they have pairs that work with them one-on-one. Okay, so there's also a lot of direct caregiving. Yep, we give the medications in the clinic. You bet. Okay, but school nursing has evolved very, very quickly over the years. Okay, a lot of direct patient care. Okay. What are some other things the school nurse does? One of the things we do is community outreach. I say we because I just spent 20 years. We're very involved with the community. We participate in health fairs. We may do our own health fairs. We may help the staff in a school-based clinic, with a nurse practitioner. We are always a liaison between students and teachers. If teachers need education, we're a liaison between parents and resources in the community, parents and doctors. So the school nurse is a really, really integral part of the health team or of the team at the school. The teachers and educators and administrators really, really rely on the school nurse. What else can you think of that the school nurse does?
They're educators. They educate the parents and the students on disease processes and stuff that the kids might have, like lice or how to get rid of lice and stuff like that.
Yep. How to give your own EpiPen. If you're carrying your EpiPen or if your EpiPen's in the clinic, teachers have to know what kids have health issues in their classrooms, right? So that they know, let's say a teacher has a couple of kids with seizure disorder in their class. Have to work with the teachers and teach them about seizures, what to look for, what to recognize, when to call for help. Right? There's a lot of kids with a lot of chronic illnesses and a lot of issues in the schools. Okay. Lots. School nurse job is a big job now. Not that it wasn't 20 years ago, but if I compare 20 years ago to last year, it's incredible how our scope has changed. And school nurses are guided by CDC, obviously, but our National Association of School Nurses, NASN, which is where a lot of our guidelines come from. So let's talk about different prevention levels within school nursing. So what are our 3 prevention levels?
Tertiary, I'm sorry, primary,
Primary.
secondary, and tertiary.
Okay, what's primary?
Prevention of childhood injuries.
So what kinds of, let's start with primary. What kinds of primary interventions might the nurse be using in the schools? And think of all different age groups. You know, we had kids, I mean, kids in the schools are all the way from 3 years old up to 19. All right, so what kinds of primary prevention activities might the school nurse engage in?
Like making sure
Application?
the student wears like a helmet if like for football,
Mhm,
helmet, everything that they're supposed to have, shoulder pads,
mhm.
Protective
eyewear.
equipment for sports.
Yes, ma'am.
Yeah. One of the things that you need to be able to review, and it should be on your study guide, is at each different age level with the kids, whether it be preschool or school age kids or adolescents, what are their risks? Like for infants, one of the big risks is SIDS. Okay. For the school age kids, one of the big risks is accidents. So we talk about bike safety. So maybe we do education on wearing helmets, wearing protective gear. So you need to be aware of what are the most common risks for each age group, and then be able to give an example of primary, secondary, tertiary. So education to prevent childhood injuries, right? Seatbelts, helmets. What about playground? What if you were asked as a community nurse, hey, we're building a new playground at the school and we need your input as to what's safe, what are safe pieces of equipment, safe surfaces, and what's not? Would you guys be able to articulate that? Okay, that's something you might be part of, right? Playground safety. So go back and review in your chapter about playground safety, what's safe and what's not safe. And remember, we talked about this in my review this morning. Remember positive and negative questions, right? Let's think about playground safety, for example. Let's say you got a question on the exam that said, pick the appropriate intervention for building a playground. So you're looking for a correct answer, maybe like gravel surfaces, right? The negative way would be, which of the following would be an unsafe practice for building a playground? Does that make sense? You have to be able to notice the difference. What about the older kids? What kinds of primary preventions would be in high school?
Substance abuse.
Substance abuse, right? Teaching about the effects of substance abuse. What else?
Bullying,
Bullying.
Teen pregnancies.
cyberbullying as well.
Yep. Cyberbullying, teen pregnancies. What about suicide prevention?
Mhm.
What about safe sex? Okay, so the purpose of this discussion is to be aware of what kinds of risks are at each level. Okay, another primary with the kids in school are immunizations, right? Because what do immunizations do? They try and prevent the common childhood diseases. I'm just giving you some examples. Okay, what about secondary? What kinds of secondary interventions might the nurse be doing in schools? Remember, secondary is screening. And I think of secondary, I think of early identification, early intervention. So what would a school nurse do with regards to secondary interventions?
Don't they give physicals? Or they used to. I don't know if they still do it anymore, but
I mean, you might do screenings for like BMIs, screenings for height and weight. That's all part of secondary, right? If the students come to the clinic, you're trying to identify what they have and try and do your early interventions, whether you can send them back to class, whether you can send them home, right? They might have itches, they might have rashes, they might have a cough, they might have whatever. So secondary is assessing the kids that come in the clinic, right, at whatever age, and trying to kind of stop that process whether it's lice screening, let's say you're doing lice screening and you have a student that has live lice. Okay, what do we do? Early intervention, send them home and get treatment. Okay, so secondary is all about identifying risk. What kids are at risk for obesity? What kids are at risk for suicide? What kids are at risk for substance abuse? And really try to work with them to prevent it from going into a tertiary level in which they now have a condition, or they are obese, or they are using drugs. Okay. So scoliosis screening happens in schools. Vision and hearing screening happens in schools. Right? Bullying we talked about. And then what happens in tertiary? What has to happen for you to move into a tertiary intervention?
Or have
Which
to have
ones?
it already, have the disease.
They have something. I don't know who needs to mute, but somebody's background is pretty loud. Tertiary, they already have the disease. They already have the condition. And so what is tertiary? Treatment. You're working to help them manage the disease. Okay, so in school nursing, maybe a tertiary treatment is medication administration. You're giving them medication for something that they already have. Okay. What about caring for your significantly impacted kids? Okay, they might have CP or might have fallen over winter break and broke their leg. They already have something. So your tertiary interventions are geared towards helping them manage what they have. Maybe short-term, maybe acute, maybe chronic. Okay. And remember, do not get caught up with education just being a primary primary intervention. Okay. Education is at all three levels, right? Education in the primary, right, is education to prevent. We just went through some of these. Education at the secondary is, let's say we've identified a group of students who are at risk of being obese. Well, then we do education maybe to what are the long-term effects of obesity, right? And then education at the tertiary is, let's say they have the ski accident and they broke their leg. We're doing education with those students with regards to mobility, how to use your wheelchair, how to use your crutches. Does that make sense? So don't get caught up in thinking education is only part of your, is only a primary intervention. It's not. It's at all three levels. Okay. Family development. What is a family? What's a definition of a family?
Whatever they say it is.
Bingo. Bingo. That's what the definition is currently of a family, whatever they say it is. There's some information in the chapter in your book. I believe it's chapter 12, maybe, that goes through what a family can look like. Traditional family, non-traditional family. But a family is essentially whatever they want to identify as their family. Who provides them emotional support? Who provides them financial support? Okay. We need to know the difference between, did you guys learn in your preparation, your readings, the difference between a family function and a family structure? Structure of the family, the functions of the family. Can anybody articulate that for me? Because we do need to know this for the exam. Okay, think about community nursing and you're doing a family assessment. This is important to know. Okay, there's 5 common functions that make up each family. It all may look different. These will all look different from family to family, but there's 5 core functions that make up a family. This is in your readings, but financial, health, reproductive, these are in your notes as well, socialization, and affective. So look in your notes to see what each one of those means, but those are the 5 core functions of a family. families are built around these 5 core functions. Like I said, it all might look very differently. For example, with financial, okay, their financial may mean you're well off, you can make good financial decisions, you have resources. The opposite of that is a family living in poverty, right? Just address another one, affective, creating a sense of identity and belonging through affection, love. That may be perfectly intact with some families, but perfectly out of whack in other families. Maybe parents have got divorced and the kids are kind of all over the place. And so these are the core functions. They all look different. Okay. Failing to meet some of these functions, like if you're living in poverty or you've got a divorce or whatever, separation, death, whatever, can lead to dysfunction. Okay, so you have to understand too, what are the characteristics of a healthy family and a non-healthy family, or functional family and a dysfunctional family? That's part of your community assessment. Okay, when you're doing a family assessment in the community, these are the things you would have to identify. Functional family, dysfunctional family. So that's all part of the functions of a family. What's family structure? Totally different. The structure is essentially what it says it is. It's the structure of the family. What's the makeup of the family? Who's the mom? Who's the dad? Who's the kid? Who's the dog? Who's the grandparents? Who are the relatives? What are the roles and responsibilities of each family member? That's your structure. Okay, so those are really 2 important concepts to be familiar with when you're doing a family assessment. Okay. What happens? What's the definition of a family in crisis? What does a family in crisis look like? What does that mean? How would you identify a family in crisis?
Could it be like if they lose their, for example, employment or any changes in their stability that disrupt like the way that you can provide for your actual family?
That's exactly right. Family in crisis is a family dealing with a real life event that becomes very dysfunctional. Okay. It either can't cope with it or doesn't have the resources to they don't have the resources to cope with it. But you have to be able to identify a family in crisis in the community. And there are lots of families in crisis right now for a multitude of reasons. What do you do with those families? How do you get them the resources they need?
You
And
have to
remember,
identify what's going on first, right? And then see if you can help them with the
Mhm.
with whatever situation is going on.
It may be a multitude of reasons are in crisis. Maybe a parent died, or a parent is ill, or a child's ill. There's been an accident, or think about if they live in poverty and they don't have the resources. I mean, families can get into crisis very, very quickly. And if you're out there working in the community and working with families in crisis, you need to be able to respond with whatever your nursing process, whatever your plan is for that family. Okay. So again, part of family assessment, community assessment, family health risks. Did you guys read, prepare and study the differences between, how do you identify family health risks? There's 3 categories we identify family health risks. Okay, do you remember what those were?
Genetics, environment,
and behavior.
And what?
behavior.
Oh my goodness, yeah. Right. So biological. So when you're doing family health risks, the first one is biological. What falls under that is what we call a genogram. So the two different, what you need to get from this is what's the difference between a genogram and an ecomap. So a genogram falls under the biological family health risk assessment. What is a genogram? Think about it. It's biological assessment. So what are we doing?
Like it detects the genes on like your family, like in the family tree kind of tribe scenario.
Yep, exactly. So you go back typically 3 generations and you do a genogram. And there's a visual of that in your chapter. Okay, a genogram is typically used with unknown health issues. Okay, if you have a family history and a known family history of heart disease or alcoholism or stroke or cancers, typically you don't need to do a genogram for that in your biological assessment, okay, because you're going to be at risk, right? Families will be at risk. But what if it's an unknown? What if a family member dies of an unknown reason or is diagnosed for something that hasn't been seen or heard of in their family? I used the example a couple of years ago. I was diagnosed with breast cancer. I don't have any family history that I knew about of breast cancer. 0, at least that I knew about. So my oncologist suggested I do a genogram. They want me to go back 3 generations and see my relatives, what they died from. Did anybody have any cancer that we were unaware of or whatever? As it turns out, we had not breast cancer, but other kinds of cancer. Okay. And then based on that genogram, I did that genetic study to see if I carried that BRCA gene for breast cancer, and I didn't. So this was kind of a one-off, if you will. Okay. So that's an example of kind of the unknown. Somebody gets diagnosed with somebody or somebody dies from something that just doesn't match the family history. That's when you would do a genogram. Okay, so that's biological. Next is environmental. That's where the ecomaps come in. Okay, ecomap. What's an ecomap? So remember, we've moved on from biological. Now we're looking at environmental risks.
Where they live. Like if
That's
there's any like
part of it.
diseases or stuff that are more towards that geographic or that city or state or country
That's part of
that
it.
affects them.
That's part of it. It
If
really
the area they
focuses.
live in has pollution,
That's part of it. It focuses on the relationships, the social relationships the family has with the community. Okay. So for example, do you live in a neighborhood that has high crime rate, pollution, living conditions, high stress environments? Okay, are there health disparities in your community? Does the family participate in religious activities? Do they go to work? Do they have relatives? It's the whole social connection to the community based on the risk factors. So for example, I'll use myself as an example. Prior to the pandemic, there's a nice visual in your chapter as well. You have a circle. Okay, that circle is you. It's your family. Then you have all these lines coming out of that circle of all the things you do. Okay, you're involved in a church, you're involved with a book club, your kids play sports, your whatever. It's your social interactions with the community. So mine was pretty full, okay, prior to the pandemic. Okay, very socially active in the community, whether it be individual or with my kids, whatever. What happened with the pandemic to everybody's eco map?
Pretty much wiped out. It's gone.
Wiped out, right? Remember lockdowns, school closures. So think about that. What are some of the after effects we're seeing now of the desocialization, if you will? Okay, we're seeing lots of issues with the kids with depression and lack of social interaction with friends. I mean, they're starting to build up again, the connections, but we all went probably from full eco maps, busy eco maps, down to pretty empty eco maps. So, and that's what's considered, I mean, it is a family risk, environmental. I mean, what if you've got kids that really don't go to school and they sit home all day and they're alone and there's just no social interaction? Those kids are going to be more at risk, right?
Yes.
So the third family risk we look at is behavioral. Okay. Behavioral is essentially your lifestyle choices. Your diet, your exercise, do you use drugs? Do you drink? It's your life choices. Okay. And those are part of the risk, part of doing your family risk. Okay. So you get your biological, environmental, and behavioral. Any questions about those? You do need to be able, you may get asked about, you may be given a scenario and asked what to do. Is it involved, would you be using a genogram or would you be using an eco map? So just understand that your genogram is part of your biological risk assessment. Your eco map is part of your environmental risk assessment. Okay. We talked about obesity being a big issue. We talked about diabetes being a big issue. I'm not going to go through the section about common childhood ailments because I want you guys, number one, this week's discussion question is on that, right? So you are reviewing those. Also, with your childhood ailments, you should have already been introduced to these in other classes, whether it be peds or med surg. Right. So in your study guide, let me rephrase that. Your notes are pretty extensive about all of the childhood ailments. In your study guide, I broke that down. Okay, so when you're looking at your childhood ailments and studying for your exam, please look at your study guide. Okay, we don't need to know everything that's in the notes. Okay, I tried to highlight the 4 or 5 most important things about each one. Okay, but I can tell you, you will get a question, if not 2, on every one of the childhood ailments. So please be familiar with those. Okay. Okay, a couple of questions for review before we get to the quiz. What kinds of ethical issues might we face in the community? Just talking out loud now. You've all had ethical issues probably in your clinicals, in your work setting, right? What kinds of ethical issues might we have in the community? Think of a hospice nurse. What kinds of ethical issues might you see there?
Helping them pass, I want to say.
What if the family doesn't all agree on the way that the end of life is being handled by the hospice nurse? Is that an ethical dilemma?
It could be.
Yes.
Absolutely. And how are you going to do? What are you going to do? What about the school nurse with kids who might have a DNR order? Right?
It might be hard for you not to want to like bring them back to the kids.
Mm-hmm. Mm-hmm. So in our profession, in nursing, we face ethical issues all the time. Can anybody give me an example of any issues they've recently faced or in the last year or so, ethical issues with their patients or their hospital or wherever their place of employment? What have you dealt with? Nobody's had any ethical issues that have come out?
Would that be the same as when a family doesn't want their loved one to have any type of pain medicine if there's anything going on with them or anything like that? Because that happens at my job all the time.
And who decides what's right?
The family.
The family or the patient?
I had an issue and it was a kind of, I will say discrimination, but I think I don't want to label it like that because I'm Puerto Rican, and there was this patient that when I came in, he couldn't tell that I had an accent, and he was like, if you're not American, I don't want you here.
Mhm.
But
How'd
he
you
was
handle
stuck
it?
with me. Yeah.
How'd you handle it?
Well, I, my face, like, thank God for the mask, first of all.
Yeah.
But I told him, well, sir, I'm gonna be your PCA. You need assistance. You're gonna need assistance with like going to the restroom and moving around. So, you're part of my assignment. So we have to try and figure something out and meet ourselves halfway. They removed him from my assignment because apparently he contacted the manager, and the manager contacted the charge nurse, and the charge nurse was like, I'd rather you be saved and like exchange this patient with someone else than having to deal with him and getting stressed out or something like that.
And how'd that make you feel?
Horrible, because I mean, most
Exactly.
people don't understand that Puerto Rico is part of the United States. So, we are Americans. We just have an accent because, I mean, our first language is Spanish. And I don't really think that most of, that, for example, I don't think that I have an accent. I know that sometimes I get frustrated trying to say some words, but it was kind of awkward the way that he reacted, especially because he was not even American. I think he was Hindu or something like that. He wasn't even American. So I was like,
okay, so let me take that one step further. What about what if it was a cultural issue?
I mean, it could have been,
right?
But I would have appreciated if he approached it in a more
totally understand.
Because I was all filled with the hormones because I was pregnant at that time. So I was like, why? And and I even talked to the charge nurse, and she told me, he was giving them a hard time regardless, like for stuff that could have been avoided or simple stuff, but it was awkward, and I felt really awkward.
Well, one of the big areas that ethical issues comes up is working with or taking care of patients of different cultures. Right? What do you guys do if you take care of a family in the community that has a completely different cultural belief or value or practices that you don't understand or you have issue with? These are real life scenarios. This happens.
Yeah,
You still have to abide by what their religious beliefs are, even if you don't agree with them. I mean, it doesn't mean that you have to practice what they're doing, but you still have to allow them the courtesy. I don't know what word you want to use.
Well, you have to try
You still have to provide
able-
the care that that is required of you, regardless of their beliefs and how you feel. Your job there is to get them to a place where they are able to care for themselves. So
exactly,
you have to. What they tell me, you have to check your emotions at the door.
That's exactly right.
Come in and do your job and provide care.
That's what cultural competency is. And that's why I'm bringing this up now in week 2, because it will carry us through the whole term and it will carry you through your whole career. All right. We evolve over our profession, over the years of our profession of being culturally competent. We need to do our best as we're developing plans of care for our clients, whether they're in the hospital or the community. We have to do our best to the extent we can in their health care plan to incorporate their culture, their cultural values, their cultural beliefs, their cultural practices as part of our profession. Okay. Not to, I just need a couple of people who don't have their cameras on to please turn your cameras on. Thank you. Chantel, can you turn your camera on, please? Okay. Okay, that's all I want to cover for right now. Let's go. Everybody pull up their quiz. Pull up your quiz 1. And because I don't want to mess up my Zoom, we're just gonna, you pull up your Zoom and we're gonna do that. I don't need to share my screen and pull up the quiz because I have it right in front of me. Okay, so we're gonna do this together. We're gonna try and do some,
It's saying that if the quiz is locked, I'm confused.
it shouldn't be locked. Is everybody's quiz locked?
Oh wait, hold
No,
on.
mine is on.
Okay, okay.
Let me go
Mine
out
is
of
open.
it.
It should not be locked. Okay. Let's go to question number 1. Which is I wouldn't put the answer in until we discuss it and come up with the right answer. Okay. Which is an example of community-based nursing? We just went through it at the beginning of class. What's community-based nursing? There's only one right answer.
Is it evaluating?
Yeah,
the
evaluating
community?
the outcomes of a community vaccination program.
Nope.
No.
I would say.
I was
it's
gonna
going
say
to be
education of the
educating
child.
Educating the child
Developing the
and school teachers.
prevention of pregnancy program.
Nope. It's B.
B.
Whoever said educating the child. Why is that secondary?
I did.
Or excuse me, why is that community-based?
Because you are educating the child and the school teacher, and they will continue educating further if they see the scenario or the situation again and again, and 2 people may turn into 5 or 10. Eventually you will be educating the whole community if they don't have the resource to actually learn about this.
That's part of the answer. Who wants to take a stab at it? Another stab? Why is it based? Because you're talking about a school nurse, right?
The
School teacher and the child.
Exactly. The school nurse is based in the community, correct?
Yes.
She's in the school taking care of the kids. Okay, all the other 3 examples, let's look at them, are all community oriented. They're focused on the big picture. Okay, so developing a teen pregnancy prevention program. That's for the community. So that's a big picture look. All right, evaluating the outcomes of a community vaccination program. Okay, that's a community task. Okay, providing diabetes education prior to hospital discharge. That's a community intervention. Where if you're specifically educating the child or the school teacher, you're in the community doing community-based work. Does that make sense? I want to make sure you guys understand that. Okay, so oriented is big picture, looking at the community as a whole. Based is smaller picture, taking care of individual clients in the community for whatever reason. Okay, so number 1 is B. Okay. Number 2, which describes the purpose of the Healthy People 2030 campaign? What's the overall goal of Healthy People 2030?
The framework to improve the health of all of them.
Health.
Correct. Right? Because remember, Healthy People 2030 is a national initiative. Right? So it would be looking at improving the health of all Americans. Okay? The other ones are targeted and more specific, so they wouldn't be overall national goals. Okay? They wouldn't be creating guidelines or treatment for the most common childhood ailments. No. Okay? So the other 3 are much more targeted and specific, where they're asking for the primary goal of 2030, and that's to make sure the nation is healthy, improving the health. Got that?
Yes.
Okay. pardon me, which is true regarding uninsured versus underinsured individuals? Think about it before we even answer
are-
this.
They are
What?
more likely to be
They are more
diagnosed with
likely
advanced
to,
To diagnose with the advanced disease.
yes,
Why?
because they
because
have
they do not go get, they don't go to the doctor.
They never went to the doctor.
Yeah.
Okay.
They
So
don't
that-
have the money to they don't have the money to afford to be able to go to a doctor or to get seen for whatever ailment they may have.
Yep. And that's considered a disparity. Okay, so if you have a family or an individual that's either uninsured or underinsured, that's already a disparity, because having no insurance or being underinsured puts you at risk for healthcare access, quality of care, ability to pay your medical bills. So if you're underinsured or uninsured, you're less likely to seek, especially primary health, right? Preventative health. So when you're not seeking preventative health, by the time you get to an ER or an urgent care, you're most likely in a more advanced stage of whatever was developing, whether it's heart disease or diabetes or whatever. So does everybody understand that? Being
Yes.
uninsured is considered a health disparity. It creates a lot of risks. Okay. So it would be C, more likely to be diagnosed with advanced disease. Okay. B is, or A is exactly the opposite. Okay. B is the exact opposite. They're more likely to develop preventable diseases. And then D is the opposite. They are more likely to need governmental resources. Okay. Question 4. Which client belongs to who's a vulnerable population? Select all that apply.
19-year-old.
Pregnant women, the pregnant woman, the substance abuser, and the 31-year-old with HIV.
Why would a 26-year-old pregnant woman be considered vulnerable?
I was gonna say the war veteran.
Yep. War veteran is definitely vulnerable. I'm getting back to why does it, if you were to rephrase A
If
to
she
be a
was
vulnerable population, who would it be?
like a teenage pregnant woman.
Teenage pregnancy. So if A said teen pregnancy, that's considered vulnerable. Okay, but it doesn't. A 26-year-old is not considered vulnerable right off the bat, right? That's considered a healthy pregnancy until they become vulnerable. But an adult is not typically considered or automatically go into the vulnerable category. They may become vulnerable during their pregnancy, but teen pregnancy is vulnerable right from the start. Okay, so A is not correct. B, is a veteran a vulnerable population?
Yeah.
Yes,
Substance abuser?
Yeah.
Yes.
And that doesn't even matter the age, right? Same with the next one. Somebody with HIV, vulnerable?
Yes.
Absolutely. What about a 23-year-old?
No.
No.
Mm-mm.
Okay. What could you rephrase the last one to be a vulnerable population?
Like a teen.
STDs, history of STDs? Okay, well, it doesn't say that. So the middle 3 are the correct answers, right? Okay. What are some other vulnerable populations? Homeless,
The elderly.
Children.
kids, mental illness. We already have substance abuse. Okay. Okay, number 5. 2 important words that you need to understand as part of community health nursing. Well, it's part of our profession, but what is the definition of, before we even look at this question, what is the definition of resiliency? What does being resilient mean?
To like withstand or recover quickly from like tough
Bounce back.
situations.
Anybody else?
Yeah, to recover from stuff that's difficult, to try to get over something.
Pushing forward, right? After
Is
all
it
the
the last one?
adversity, go ahead. After all the adversity, you're still pushing forward. Part of our job as nurses is to help patients, help clients be resilient. Okay? The more resilient our patients are, our clients are, the better they're going to do. The less resilient they are, it's more likely they may not work as hard or give up. So resiliency is an important term in our profession. We need to, that's part of our plan, it's part of our health plan for all patients, is helping them become more resilient. Other word that I want you to become familiar with is motivation. Okay, it is part of our responsibility to figure out how to motivate. How do we motivate people to come to our education classes in the community that don't want to? How do we motivate the elderly population that they're set in their ways and they don't want to learn a different way, a new way to do things? Because part of our role in the community, a big role, is an educator. Okay, we're a teacher, we're a counselor. It's critical to figure out how to motivate. How do you motivate a preschooler versus how do you motivate a high schooler versus how do you motivate a elderly client? So resiliency and motivation are extremely important definitions that we integrate into this class. So let's go to question 5. What statement reflects the term resiliency as it relates to vulnerability?
A.
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 Mhm.
Okay.
Right? B is exactly the opposite. C has nothing to do with it. Resiliency has nothing to do with our genetic predisposition. And D, it doesn't have anything to do with it either. Okay? So you have to be thinking as part of your plan and working with clients, how can we increase the resiliency? I mean, we've all seen examples of families or individuals becoming resilient and pulling themselves up and out of the current crisis and moving forward with positivity, right? But we've also seen the other opposite effect of that is lack of hope, lack of motivation, and people give up. All right. Question number 6. Okay.
Wait, what was the answer? The B?
A.
A.
A. Right? Does that make sense? Resiliency reduces. The more resilient you are, the less at risk you are. Okay, question 6. Okay, this is, what kind of question is this?
Priority.
Priority. So what's the important word in this question?
First.
First. So who gets to get seen first in this busy clinic?
The 9-year-old complaining
B.
Why?
C.
airway. I think an airway.
Mm-hmm.
What is a cough? What is a cough and unable to participate in activity? What is that a pretty good
Exertion.
Asthma.
an impending asthma attack,
Mm-hmm.
right? So who gets treated first?
The 9-year-old.
The potential airway issue,
Mhm.
right? All the others are there for a reason and they'll get tended to. But the question asked who is first. So you would have to think ABCs. That 9-year-old is potentially on the verge of an asthma attack and needs to be tended to first. Does that make sense?
Yes.
Okay. Okay. Number 7, which food should the nurse recommend for a child with iron deficiency anemia?
Bananas. No, eggs.
Eggs.
Why is it A?
They're full of protein.
This is rich. Thank you. Rich in proteins. And
Okay, does
cow's milk, we know that's very low in iron.
Does that make sense? You guys understand why it's A?
Yeah.
And I'm sure you've already been introduced to iron deficiency anemia, right? Whether it's in peds or med surg, right?
Yes.
Okay.
So the answer is A, right?
Okay, this is an interesting question. We always end up with a good discussion from this question. The school nurse notes that the dark discoloration along the neck crease and the armpits of a child. What steps should the nurse take? Well, first of all, what might we be looking at with that description? Dark discoloration along the neck and armpits. What might that be?
Type 1 diabetes.
Okay, but what's the condition? That's the dark discoloration around the neck and the armpits. What's a pretty good symptom of diabetes?
COVID.
It's hard to pronounce it. I just call it NA. Guys, remember
That's not the
that?
same thing as Mongolian spots because those are used on the butt, right?
Yeah.
Those are
But
your
there's a
baby.
formal name for it.
Shortages.
I don't know how to.
Medication.
No, I have a hard time
background is really
pronouncing it. That's
loud.
why I call it NA.
Is it
Anthracosis is the second part of it. Narcorin anthracosis.
Anthracosis?
Exactly. That's what dark discoloration along the neck crease and armpits is. Okay. And that typically could be a sign or symptom of type 1 diabetes. You guys remember that from med surg?
Mm-hmm.
Okay. So what do?
Advise parents to obtain a full medical evaluation
Why?
so that if the child do have diabetes, they can get treatment.
So that is the answer, B. Does everybody understand why it's B?
Yeah.
Okay, why would we be evaluating the scalp? It has nothing to do with it. As far as the child using creams, child may not even be on creams or have anything, and that wouldn't be part of our assessment. Okay, and since we don't know what's going on at this point, how can we recommend an iron-rich diet? Right? So the purpose of this question is knowing that NA is a potential symptom of diabetes 1, type 1. Okay. Okay. Which nursing
Somebody's
intervention
background
is
is really loud.
what?
Yeah.
Someone's background is really loud.
Who needs to mute their background? Chandra, will you come on camera, please? Who needs to? I don't know who's unmuted. Who's unmuted? Okay. Chandra, I'm still waiting. I can't see you. I'm looking at a light at the top of the ceiling.
I'm sitting at my breakfast counter. It's the way that I have my
Oh.
counter sits. I have my stool sits.
Okay. All righty.
And I'm shorter than
it. Which nursing intervention is a priority? So what's the important word there? Priority for a child experiencing developmental delay. So this is a good example of a question, reading a question, not picking up on the word priority, and then all the answers look like they could be right? Pardon me. So what would you do if you came to this question and you didn't pick up on the word priority? What would you do? Would you go back and reread the question if everything looked correct?
Yes.
That's what you have to do. Okay. What's the right answer?
A.
A.
Why?
I was gonna say the family history of developmental delay.
That is because it's priority and
Exactly.
they look at priority, the lead exposure is the priority at that moment. You can worry
Correct.
about everything else at a later time.
Exactly, Timberly, thank you. Family history will be important at a later time. Okay, physical assessment, assessing lung sounds, heart sound will be important at a later time. But the question is asking, what is the priority? All right, and we know from our readings this week What are the 3 potential major problems with lead exposure in children?
Developmental delay.
Developmental
Another
delay,
Neurological damages.
neurological. What's the third one? It's in your readings.
Can't remember. Was it heart problems?
Go to your module. In your second page of reading, the first page was school nurse, and the second page was lead poisoning, lead exposure. What's the third potential big problem? You guys know what I'm talking about when I tell you to go to your module, right? And do those readings. You have 2 pages of readings in your module, in addition to your book readings. Your second page is lead exposure. I just want to make sure you can find it. That's why I'm going to ask you to. I could provide it to you, but I want to make sure that you see where it is. Do y'all know what I'm talking about?
Trying to find it.
I see the paint chips. Let me see. Harmful lead hazard environment.
There's 2 places that it mentions these 3 things.
Environmental development, and so I
What?
don't know, it's a cognitive delay.
Is that what are the 3? They're listed in bullet points. I can go in and find it as well. Are you guys in on the lead exposure page?
Is it the learning and behavior, hearing and speech problems, slow
Yep.
growth and
Go
development?
above that. Go above it towards the top of the page.
You're just slowing down.
Well, I guess maybe I should stop here. Does everybody know how to navigate to these 2 pages?
I'm here, yeah.
Me too.
Okay. Is everybody on in the module on the lead exposure page?
Yeah.
Okay. What does it say at the top of the page or right after that big picture? What are the 3?
Effects of childhood.
What are they?
All I see is lead in paint, soil, air, and water. You can see damage to the brain and nervous system.
Okay.
Slow growth and development.
Okay.
See
Learning.
cognitive delay.
And what's the third one?
I see learning and behavior problems.
Okay.
And
So that's your third one. Okay. So those
So
are the
what about
3.
hearing and speech?
yeah,
Hearing and speech.
problems.
Okay. So those are all the areas that's where I wanted you to see. Okay. Of what the biggest potential complications of lead exposure is. So we answered number 9. Number 10. Okay. This is also a good question up for debate. There's always a good debate about this. The nurse notes a child's BMI is in the 90th percentile. Which intervention is appropriate? Well, first of all, what does a BMI in the 90th percentile mean?
Child is overweight.
Obese.
Okay. So what do you do?
Refer for urgent medical evaluation.
Encourage parents to reduce overall screen time.
Mm-hmm. Why would the child need to go for an urgent medical evaluation like right now?
I didn't think that was the answer, but all the other answers just don't make sense to me.
Okay.
What she said about C, only thing I can think of, probably the child is sitting in front of the TV all day long, probably snacking, and that's how they, being overweight and not exercising.
Right.
Yeah, exactly.
Yep. That's the correct answer is C. Yep. Because obviously we wouldn't do A. B is a little overboard for right now. That's probably something that needs to be between the family and the physician. And how do you know they haven't already done a medical evaluation?
That's a tricky question. I would have been sitting on that question. at the
Tricky
screen.
question too.
You what?
I would have been sitting on this question on the exam, going back and forth for a little minute before I picked the answer.
Between B and C?
I
Yeah.
thought because like sometimes like when you're engaged in something else, you might have forgot that you ate, so then they feel like they're more hungry.
Okay. What, so Seneca, what answer are you talking about? Which one are you talking about?
Like, that's why I would have picked speed. It's because when you sit,
Oh.
like I know it's like when kids sit in front of the TV and like they're looking at their show eating, like time the show is over, they're like, oh, like they might have felt like they ate.
Okay, so based on what you just said, why wouldn't you first encourage them to reduce their screen time so they're not sitting there eating during their screen time?
I mean, I would, because the screen time would have been the problem, like with them eating, like snacks.
But I don't know. That question is like automatically assuming that the screen time is the problem. Like if you encourage parents to reduce overall screen time, you automatically assuming that all the kid do is sit in front of the TV. And
well, don't read too much into the question, April.
Okay.
Don't read too much into the question. You could make a whole bunch of assumptions from this question.
Yeah.
But we are not as community. I mean, I don't think that this is a refer for an urgent medical evaluation. Maybe if you rephrase that and said, have you spoke with your doctor about your child having a BMI at 90%? Maybe that would be the way to approach that answer. But as far as referring for an urgent medical evaluation, obesity is a long-term problem. This isn't something that's acute. Does that make sense?
Yes.
I'm trying to talk you through it of how you would have got to the right answer. Don't read too much into the question. I think that's it. That's 10 questions. Did you all get a 10?
Yeah.
Okay. The last thing I want to cover is your HESI prep assignment. Pull out your HESI prep assignment. Okay, and I'll repeat. I need you to be printing out and using the HES or saving it to your desktop. The HESI prep assignment I sent out with the week 1 announcement. That is the updated HESI prep assignment. Okay, do not go to week 9 when it's due, where there's a link to download this form. That is the old version. It didn't get pulled out. My apologies. And I've explained that a couple of times now. The HESI prep assignment I want you to be using is from your week 1 announcement. The reason I'd like to bring up the HESI prep assignment in each class is this is going to turn out to be a very big assignment for you in week 8 if you haven't started it. And if we address it in class every week, we can see the subjects, the topics, the content we're covering. And so you can be filling it out weekly or every week or whatever. If you have it handy during class, then we can complete it. So what I've determined with my previous classes this week is we have now covered the section. It would be your 4th section. So bioterrorism 1st, disaster level 2nd, epidemiology 3rd. We have covered, for the most part, health promotion and teaching. And all these little bullets under each box, I have reviewed the HESI for the last 3 terms for PN. Okay, I don't know what questions they're asking, but I certainly know the topics they're covering. Okay, so when I look at the HESI remediation and the breakdowns of what previous students have done, these are the topics that are asked about on the HESI. So for example, Under health promotion and teaching, the first one is preventing health problems. There was a question asked about infant death rates. There was a question, I don't know what the question was. There was a question asked about lipid screening. So for this assignment, this isn't a complicated assignment. I just want you to, what goes in these boxes is what it is. Why would you do lipid screening? Think of the nursing process. Why would you do it and how would you do it? Okay, this does not have to be a complicated assignment. You need to know what each topic is, give a brief description of it. And like back on the first page with bioterrorism, when you think of anthrax, and we'll get to this in a couple of weeks, when you think of anthrax incubation, what does it look like? Think nursing process. What are they going to present with? How do you treat it? Smallpox. What are they going to present with? How do you treat it? Ebola, sarin. Okay. That's easy to do the nursing process with those because you can list out what are the symptoms? How do you treat it? But when you go to the section of health promotion and teaching, you have to think about ADPI in a different way.
Miss Laura.
Yeah.
I'm sorry, I apologize. I printed it out, but I cannot find where my papers are that I printed out. So you
just
said
take notes.
Okay, you said what do we need to know, or what do
We're
we
in
need to write
we're
the
in
box?
section 4. We've covered 2 sections so far in the first 2 weeks. We've covered section 4, which is health promotion and teaching. Like in the second box under health promotion, recognize alterations in health. What does conjunctivitis look like? That's one of your common childhood ailments. What does diabetes look like? What does eczema look like? Okay. So you can tackle number 4. Health promotion and teaching goes from page 2 into page 3. Okay. And then you can cover the very last section, which is vulnerable populations. Okay. So what are migrant workers? Why are they vulnerable? What are their risks? Right? Rural populations, homelessness. We covered this all last week. Okay. So my suggestion would be that you go through this, fill out those 2 sections to the best of your ability. Again, it doesn't have to be complicated. I just need you to understand, who are the vulnerable populations that are listed out for you? Why are they vulnerable? Well, if you go into the first one, which is migrant farm workers, why are they vulnerable? If you go next one, rural populations, why are they vulnerable? Homelessness, why are they vulnerable? Okay. So this is simply this, there is right or wrong answers, but this is a prep. This is an ongoing work in progress prep so that by the time you get down to week 9 and you're getting ready to study for the HESI, this packet is all filled out. Does that make sense?
I have a question. Is this something that if we start to fill out and have questions, can we send like a page to you and say, hey, can you review this, make sure I'm on the right page on what
Absolutely. Absolutely. What I really want to get you to understand is how important it is to keep up with this, because this will help you in the end. Okay. Because now you're going back to a few areas on this that we've already covered. Your information is should be quite current, and you can go ahead and fill it out. Whereas if you pull this out in week 8 and it's blank, it's going to take a while to figure out.
Right.
Does that make sense? This is what you're going to use at the end of the term to study for your HESI. So we might as well be filling it out as we go. So by the time week 9 comes around and you're 2 weeks away from your HESI, all you have to do is hit submit, and that's your study guide. So this is kind of a work in progress study guide. This is one of those assignments that you may not understand the importance of starting it now and filling it out as we go through the term, but you'll appreciate that in a couple of months. Does that help? And the other thing too, I tell students, if you guys want to work on this in groups, I'm fine with that. Okay, this is meant to be a tool to help you. If you like to work in groups and you already have a study group put together, and this is something you want to work on in your study group, by all means. This is a tool to help you. Okay. Okay, so next week, I think next week after this week, just think your 2 discussion questions are out of the way. No more discussion questions the rest of the term. Okay, next week, I believe you have an NCLEX, your first NCLEX, right?
Mm-hmm.
Please be careful about working ahead. Please don't go too far ahead. Please. Just FYI. Not many of you have, but some of you have. Just be careful. Next week you have NCLEX. Next week we have content. So I'll be doing a content recording this weekend. Next week we have exam reviews, Monday, Wednesday, Friday. And then the following week we have our exam 1 in week 4. Okay. And then next week I'll spend part of class 2 just reviewing the structure of the study guide and how it's put together. I'm not doing a review, but I'll address that as well. Do you guys have any questions? Has this been helpful today?
Yes.
Yeah.
Really good discussion. I appreciate everybody's input. I really do. Does anybody have any questions?
No.
Okay. Okay. Well, that's all I have for today. I hope you guys have a really good weekend. If you have questions and you want to stay on after.
First, I have a question after everyone leave.
What?
Yeah, sure. Yeah, I would stay.
You wanted me to stay after anyway today, right?
Brittany, yeah, stay on for a
Yeah.
second.
Okay.
Yeah. Yep. Anybody else have any questions? I'm done. I hope you guys have a good weekend. You guys know how to reach me. I know I have pending emails starting at 11 o'clock last night.
No,
that
I'm not.
just haven't had a chance to respond to. I've been teaching all day, so I'll get to those this afternoon. Okay. So I hope everybody has a good weekend. Good to see everybody.
Have a good weekend. Good night.
Thank you. Have a good weekend, everybody.
Bye.
Be
Hi,
safe.
Professor. Hi. Hello.
Hello. Hang on. Let me.
Okay, Professor, do you have me down